I know that this is Affordable Care Act, but that's because I'm all about recycling, and this is sort of the beginning of our old PowerPoint. But the inside is all the new stuff, I promise you. So we're going to talk a little bit about BadgerCare, what's been going on in the last year, but really only the bullet pointed pieces, because I want to make sure people understand this issue pretty well as what's about to happen and kind of where we go from here. I really do believe, and I've been kind of a broken record on this, that BadgerCare is going to be a major issue moving forward in healthcare, but in Wisconsin especially. It's been incredibly popular, and it's incredibly controversial what the governor did. So it's important for us to understand this because this is not going away. And so let's just go ahead and get started. Okay, so in case you guys are unfamiliar, before the Affordable Care Act, it was low-income individuals often had to go without guaranteed coverage to get affordable care, or guaranteed access to affordable coverage. If you were low income, if you had a pre-existing condition, or maybe had no job or were unemployed, getting health insurance was very difficult. Our state, we had BadgerCare, which is a Medicaid program. Many other states did not. So the Affordable Care did not have a substantive Medicaid program. But our state did, and the Affordable Care Act said that they were going to fill in the holes in our program and expand Medicaid programs in other states, and this is the opportunity that was put before us. And so now, once this piece is taken care of, once we address this issue of federal funds for BadgerCare, we can really get to a world where we'll have guaranteed access to affordable coverage no matter what. Some of you may have noticed that there's a little chat function at the bottom. You can ask me questions throughout. I'm going to try to answer them. Try to keep most questions toward the end if possible, but if you have one, especially if it pertains to the individual situation that we're looking at, that would be great, and that way I can try to answer them as best as possible. So, okay, moving on. A little bit of a delay. Here's what happens with the Affordable Care Act and how it impacts BadgerCare and how we got to where we are now. So the Affordable Care Act gave billions of dollars in federal funds to Wisconsin specifically and every other state to fill in the holes of BadgerCare. Most of you guys are familiar with this part. You're also familiar with the fact that the Supreme Court gave states the ability to reject this additional federal funding, something that the governor chose to do 1 year ago this month. The legislature, again, agreed with this decision, but as many of us are familiar, it costs the state more money to cover less people. So we're kicking people off of BadgerCare. We could have covered a lot more people and saved a lot in the process. So that's not, unfortunately, what we chose to do. The good news is that because of the Affordable Care Act, people forced off of BadgerCare will have access to new health insurance marketplaces, new private options. The bad news is it's supposed to be very hard for low-income people to afford this because the law assumed that this group would end up on BadgerCare. If you're an individual with no children and you make $12,000 a year, you can't be on BadgerCare any longer. You'll be having to go get private health insurance. And now there will be tax credits and subsidies to help you afford it. In many cases, it'd still be too much out of pocket for someone who makes about that much. And so this was a situation where, yes, it's good that there's tax credits available. It would have been better if they were guaranteed BadgerCare. And as many of you know, we can accept the federal BadgerCare funds at any time. And so it's my belief that this absolutely will happen. The state will take federal Medicaid funds at some point. And it's just a question of how long. And I'll explain why I believe that more in a minute, but I want to go back many years to 1965. 1965, Medicaid was first passed along with Medicare, and a lot of states didn't do it, kind of like right now. A lot of states decided to dig in their heels and say that they weren't going to pass it, and then a handful of years later, every state in the union had a Medicaid program. A lot of them looked different from each other, but eventually they all took it, because there's only so long states can hold their breath, and eventually this will be taken care of. And back then, it's 1965, the deal was a lot less than it is right now. All right, we have a much better deal for the state. So moving forward on this, a little bit of a delay here. There we go. Okay, dates to know. I just want to make sure people are aware of this. They're coming up pretty quickly. March 15th is the deadline to sign up for private coverage or to sign up for BadgerCare if you want coverage to start on April 1st. All right, if you want coverage to start, no gap for people being kicked off BadgerCare or whatever, you have to sign up by March 15th. That is a month from this Saturday to be able to get that covered. March 31st, roughly 83,000 people, mostly parents, will be kicked off of BadgerCare. They will have about 60 days from that date to access private coverage on healthcare.gov. And so after March 31st, technically this open enrollment session in the Affordable Care Act is over for most people, but these 83,000 people will have 60 days to go to healthcare.gov and get private coverage that unfortunately will be a little bit too expensive for them. But that's right now the only option they have. After April 1st, anybody who is qualifies for BadgerCare under the poverty line can access it. Unfortunately, if you are currently under the poverty line, you cannot access BadgerCare until April 1st. That's sort of been the backstory with what the governor has done. He's denied access to certain people who are just over the poverty line, and for anybody who's been under it, they cannot access it until April 1st. And so, if you're under the poverty line, between January 1st and April 1st, you've had nothing, nowhere to go. You cannot get cannot get covered pretty much anywhere, which is unfortunate. And right now, too many people are putting off care that they should have had. They should have been promised BadgerCare. Okay, moving on. Again, before you assume this is a partisan issue, I just want to make sure everyone's aware. The following are states led by conservative governors who have spoken out in favor of accepting the federal funds. Most have. So again, here's an example of states that, even though they are led by conservative governors, they found a way to take the funding. It is absolutely my belief that at some point this state will take it, and if it's done through a Republican governor still, a conservative governor, they'll find some sort of rationale just like these states have done. Or if it's in the other side's control, they'll realize that it's an important thing to do too. So no matter what, the state is going to take this funding. Too many states have said it's worthwhile. So first off, why are we talking about this at all? Why does this matter? This matters for a whole variety of reasons, some moral, some fiscal, some economic, some healthcare. And groups across the political spectrum, across the issue spectrum, have spoken up and said, we need to do this. Government groups like the Wisconsin Counties Association have said this is good for our counties because our counties help pay for healthcare programs for the low income. And if we could get them covered in BadgerCare, they could get preventive services instead of emergency services. Membership groups like AARP are saying, look, our members are having a tough time being able to access private health insurance before this law. This is good for our low-income membership. And advocacy groups like Disability Rights recognize that too many people are stuck without health insurance, unable to access programs like Medicare or anything else. And so we need to be able to give this, for efficiency's sake, for fairness' sake, an option for our citizens. And religious organizations like the Catholic Conference, the Jewish Federation, the Council on Churches, and the Lutheran Office of Public Policy have all said that this needs to happen. We need to help, for moral reasons. When we have the ability to offer health insurance to more people at almost no cost, in fact, saving money, it's a moral imperative for us to do this. And even medical systems like the Hospital Association, Aurora Sinai, et cetera, have said that for their business to operate effectively, we need to take these federal funds. And even doctors groups and nurses have all said this. So pretty much from all perspectives, this is something that we need to do. This is something that we're eventually going to do. And you can't hold your breath forever, not in the wake of groups across the state saying this is worthwhile. Okay, in front of you, you're going to notice a really quick picture. I realize I should probably verbally say some of this because I have a few people who I believe are only on the phone. But in front of us, there is a picture of the state of Wisconsin and 19 counties that are highlighted. The reason we're highlighting them is because these are a list of counties that have all passed local resolutions calling on the state to turn around and take the money, or in some fashion to let these counties accept it on their own. I'm going to explain that in a second, but quickly, I'm just going to say that the counties, for those who are listening on the phone or only and are not watching the screen, are Oneida, Lincoln, Marathon, Dorr, Portage, Outagamie, Manitowoc, Winnebago, Milwaukee, Jefferson, Rock, Dane, Iowa, Richland, Wood, Clark, La Crosse, Eau Claire, and Dunn. Kind of a mouthful. But all these counties, and more considering, have sent messages, these nonpartisan elected officials who, understand this at a local level. And so it's been a great way for individuals and people who care about this to kind of send a message to Madison that this is absolutely something that needs to happen. So I've kind of gone over this rather quickly, explaining the backstory to the whole BadgerCare piece. I want to talk a little bit about where it's going from here and how we're going to make this a priority. So here's what's going to happen. Our plan is to make sure that the state of Wisconsin says yes to BadgerCare in some fashion. We believe that this is something that any party will eventually do, and many on both sides of the aisle have done. But if they're going to refuse to make this a policy priority, then we need to make this an electoral one. And the good news is that this is already popular. There was one poll that came out a little while back that showed 57% of the state supports this across issue lines. That less than about a 20-point margin, people supported accepting the federal funds. So this is old data or old polling. We actually have newer polling that shows that this is even stronger than this original number, and that it really, really is effective reminding people that government has a role in controlling people's lives. It's especially effective with women. It especially reminds people that this is still a decision that needs to be made. I got a question here about the Townships Association. To my understanding, the Wisconsin League of Municipalities, I believe is the organization, has not weighed in, although if they have, I may have missed it. The other reason that we think this is a good issue moving forward is that this issue, BadgerCare, is already seen as a yes or no question. Will you support taking the federal Medicaid funds? Yes or no? And because it can be done at any time, this is something that will continuously be a question. And again, it crosses traditional left and right issue things. You can't just be a knee-jerk conservative response when there are conservatives who found reasons to take the money. Additionally, it's local. And so one of the things that we have been doing is promoting around the state the fiscal and the human impact on every single county. We have a breakdown. It's not in here, but we have a breakdown of how much money and how many people are going to be impacted in every single county if the state took the federal funds or if the county did. And the backstory with that is that last December, State Representative Melissa Sargent introduced a bill that would let counties accept the federal Medicaid funding if they so chose. And this is something that's been circulated around. It's gotten a lot of attention, but it's not a brand new idea. There is a county in Ohio and a few others that have been given federal permission to accept these federal funds locally. And so we have gone around reminding people that this issue is still important and reminding counties that this is something that there might even be an alternative means for them to take the money. Now, this is not the best solution. The best solution would be to accept the federal funds at any point and do what is best for making sure low-income individuals can access federal funds. But really what this all means is that this year, 2014, we will continuously talk about BadgerCare because of two reasons. First off, the state could change its mind at any time. Hypothetically, the state could take the money before the election, which is a victory for those who need health care. And as far-fetched as this idea may seem, it is important to point out that traditional inside lobbying has not worked, even by some of the biggest organizations like the Hospital Association, the Medical Society, the Counties Association, and even the Metropolitan Milwaukee Association of Counties, or Metropolitan Milwaukee Association of Commerce, the Chamber of Commerce here in Milwaukee. They've all said that this is something that needs to be done, and even their strength couldn't do it. And so this can still be done. I honestly believe that if you show that this is a politically damaging issue enough that they can change their mind. They've already called one special session on BadgerCare last November. There's really no reason to think that they couldn't push for a second one. I have Joe here asking where the county numbers. We have them on our website. You can check them out at citizenactionwi.org. And anybody who emails me, I will send you your county's numbers for how many people would gain BadgerCare in your county and how much federal funds would come into your county over the next few years. It's quite substantial. Okay, moving forward. So we're going to continuously be talking about BadgerCare. I'm not going to stop talking about it. It's really going to be, I'm really going to seem like a broken record, and that's partially because I honestly believe that we can never stop talking about this, and because I'm exercising message discipline. We want to keep talking about it. So here's what you can do. This is really important because we really want BadgerCare to be an issue that we can help convince people to get involved with anywhere in the state and to give them the tools to do it themselves. I hate turf battles. I hate trying to come into your community and do things for you. So I want to help you guys have the power to organize your local communities, to get your organization and your networks of people involved, to do things locally that advance the statewide campaign in partnership with us, but never led necessarily by us. So here's examples of things that you can do. I'm hoping we can partner on a lot of things moving forward, because this is going to continuously need to be an issue moving forward, and I'm going to need your help. So here's what you can do. Help us get the word out by sharing a BadgerCare petition, which I'm going to email you after this. Organize local events to help promote it, what this is, to educate the public, maybe see if we can get local officials to speak out in favor. We actually have ways on our system to track who you recruit and have local and can let you have access to them. And so that way you can either use this to form a local group to promote BadgerCare, to grow your own organization, or even to build upon the one you already have. If you want to help us get the word out on BadgerCare, we'll help you use it as a way to get more members of your own, as well as help get a group going in your local community of people who care about this issue. We also encourage you to help us reach out to organizations to encourage them to endorse accepting the federal funds. We have over 260 groups across the state, across the political spectrum, on our website who have publicly endorsed taking the federal funds. We want to continuously grow that. So if you're part of an organization or ones in your local area that you think should be weighing in on this, I encourage you to just reach out and ask them. I encourage you to just get them to be public on this, and we'll keep a big, long database of all the groups that have. It's been incredibly helpful for convincing the public that they should be paying attention to this no matter where they are. Here's the other thing that I need your help with. We need to explain to the people what's been going on at the end of the month, what's about to happen, so they understand what's moving forward on BadgerCare. You are one of the individuals who is under the poverty line. You are currently being denied BadgerCare. You should have it, but you are currently being denied BadgerCare until April 1st. That's when you'll be able to gain it. If you were just over the poverty line and you currently have BadgerCare, you will be kicked off unless you are a pregnant woman or a child. But if you are not a childless adult or a parent, and you're on BadgerCare and you're over the poverty line, you will be kicked off on March 31st, and you will have 60 days to get private coverage. It's important that people understand that. So March 31st, people are being kicked off. April 1st, a few more people are being added. So that's the whole backstory. And toward that goal, we could really use your help. We want to have actions set up around the state to help draw attention to this issue. And we think that these dates here are effective ways to get local media attention, to remind them that this is happening. And so leading up to March 15th, I would really love to work with you to set up an event to either promote this in, say, a town hall or a small meeting or a media event leading up to March 15th, to remind people that that is the deadline for signing up for BadgerCare if they want it to start April 1st. It's an important date to promote. So after this presentation, I have a little survey that I'm going to send to you that I hope you can fill out. Let me know if you can work with us to set up a local event to promote leading up to March 15th. March 31st/April 1st is when people are being kicked off and some people are added. And so this is a big event, a big day where we really want to help get more attention on this issue of BadgerCare. It's going to be in the news. It's important for us to make sure it's in the news in the way that we want to talk about it, around fairness, around the fact that people didn't need to be kicked off. More people could have been covered. And so I really want to work with you on these 2 days especially, because we think a lot of attention will move forward. So other ideas, other things that you can do locally to help get the word out. I see there's a couple of questions here. I'm going to answer them in a second. Let me just get through this slide. Here's other things that you can do locally to help us promote this issue of BadgerCare, help us get this moving forward even further. Please reach out to county supervisors in your area if they have not passed a resolution. 19 counties have, and the counties association has, but the vast majority of counties have not even weighed in on this issue. So it's worthwhile to encourage your county supervisors to introduce a resolution, and I have one that I can give you to speak up. In fact, I have a little white paper that shows in every single county what the impact to that county would be if they accepted the federal funds. So I will help get that to you if you are interested, and we can help make sure that your county gets to speak up on this issue too. see if we can't get more counties to speak out on the impact, because they're feeling the economic impact, but most of them don't realize it. So we want to help get this out. Also, email me to schedule a local conference call to update your friends and figure out a local strategy together. I will make myself available. If you got a group of people who care about this issue or you think could care about this issue, let's set up a conference call, 10, 20, 30 minutes. I'll explain the issue. We can figure out what we can do locally to help organize in your area. I'm happy to do that. Just send me an email. Additionally, share our petition and more. We'll help connect you to people close by who want to work on this. If you share our petition or share our other events, we'll give you access to those individuals who signed through you and in your area to make sure that you can help form something locally and we can really get the word out locally. Also, email me if you want to organize a local event in your area to educate people about this issue and remind them to enroll in healthcare coverage while they still can. I will make the trip wherever you need me to go. Happy to do it, but I need you to invite us. So let us know. And the last one is to join our social media team. Agree to share things on Facebook and Twitter. The reason for this is that Facebook keeps reducing its reach in Facebook pages, and so we have been asking people to join the social media team. We'll send you the best updates, what's been going on that people need to hear about, and we just ask that you share on Facebook and Twitter to make sure that that word gets spread. So we do this maybe once, maybe twice a week, and let us know about that. So the survey that I'm going to send to you after this, check that out, and you can let me know which one you think is a good idea, but I really encourage you. So let me get to these questions that I was just answered. From Ian Gilson, for people just over poverty line who buy coverage on the exchange, what will the out-of-pocket expense be? Oh, that's a fantastic question, Ian, or Dr. Gilson, I should say. If you are over the federal poverty line, which is about $11,490 for an individual and a little higher than that for a family, you have a choice. You can choose either a bronze plan or a silver plan, and you can choose gold and platinum, but these tax credits really are based off the cost of bronze and silver. If you choose a silver plan, you can probably expect, depending on the plan, around $2,000 deductible. It can be lower. Some plans are lower, but it's about $1,500, $2,000 deductible for a silver plan, about that. There are available tax credits that will help pay for that. There may even be, I have to double check, I did hear that there was one company in certain parts of the state that do a silver plan for low-income individuals of that poverty area that has very low, almost no out-of-pocket, but I'd have to double check. Bronze plans are different. Bronze plans will have a higher deductible, but it'll have almost no monthly premium. And so a silver plan monthly premium might be $20 to $40, depending on how much income you make. A bronze plan could be nothing, or maybe just a few dollars a month, but it'll have a very high out-of-pocket cost. It could be up to $5,000, which again seems outrageous for someone making $12,000. But at the other hand, it really makes the insurance sort of a last-ditch thing that if you really, really need it. So at least you have that protection. Another question I have from Andrea is, Grassroots North Shore is currently doing phone banks to sign people up for the Affordable Care Act. Thank you, Andrea, for reminding me. We are also trying to make sure people understand that they only have a handful of time to sign up, and we want to help make sure people know where to go. So I know Grassroots North Shore is helping to do phone banks. If you want to do a phone bank in your area or call people, we'll help get you lists. We'll help get you people who we believe are leads that need health insurance, and we can do whatever else is we can to help. So that's fantastic. Grassroots North Shore, can't say enough about them, that they're fantastic. So when we accept these federal funds for BadgerCare, we will live in an America where everyone has the freedom to control their own healthcare decision no matter what. So I want to thank you guys for listening to me. Please go ahead and ask me questions now. I will stay on and ask. I do have a cool survey that I will automatically redirect you to when I'm done asking questions, just to let me know how you thought this went. Let me know if you're interested in any of those things that I brought up that you could do, and any questions you have, like if you're impacted, that sort of thing. Stick around for a few more minutes, but please ask me questions in the chat bar now. I don't know if we're unmuting people. I don't believe we are. But please go ahead and ask me questions in the chat bar now. I must be pretty darn thorough. I'm not seeing too many questions. Oh, there we go. Remind people that they'll be able to review this presentation on Grassroots North Shore's website. Hey, everybody, you can review this presentation on Grassroots North Shore's website, www.grassrootsnorthshore.com. We will also put it on Citizen Action's website, www.citizenactionwi.org, and you can find out more of what we're up to. I'll email you that. If you signed up for this, I should have all your emails. Expect that tonight or tomorrow morning at the very latest. It depends if I can get them all in one place. But I'll let you know all these things I sent you, including the presentation. I have Barb Dawson here saying, why don't they take medical costs into consideration? I have cancer. I guess I have to understand the question better. Do you mean medical costs in consideration for BadgerCare or for private coverage? Why don't you ask me the question again? I'm going to move on to the next one. T. Schmitz, what have been the small business impacts so far from the Affordable Care Act? Let's see. Unfortunately, the SHOP marketplace, the small business health insurance marketplace, is not on the website. The website's not public yet. They delayed that a year. But the good news is that a lot of small businesses that I know have successfully enrolled and are paying better. For example, Citizen Action, as an organization, enrolled in one of those Common Ground cooperative healthcare plans, and we are actually paying less for a better plan. We now have a gold plan. I'm very excited about that, both as a healthcare advocate and an employee of Citizen Action. So it's been very helpful to many, especially since as a small business owner, you can no longer be charged based on the gender or health of your employees. And that's a huge thing. If you have sick employees or more female employees, you are paying out the nose. Okay. Joe, what is Walker's logic in refusing the money? Well, you're giving him a lot of you're giving him a lot of leeway here. But the argument that they're throwing at us is that we can't rely on the federal funds to continue being here, which is silly on so many reasons, because he is still adding people to Medicaid, and that still requires federal funds, except instead of 100%, they're only getting 60% from the federal government. And on top of that, for the federal Medicaid funds to not be there, they would have to change the law in both houses of Congress and have the president sign it for it to not show up. It would be like Medicare suddenly turning off one day. So it's a great talking point for Tea Party types, but it has no basis in fact. And so they're going to continue writing that, and which is why we need to continue talking about this issue. Okay, I thought the Kaiser Group was backed by the Koch brothers. No, not the case. Kaiser Family Foundation is a fantastic website that has a ton of information about the Affordable Care Act and healthcare reform. Very well regarded. I get a lot of my stuff from them. Let's see. Why did my insurance costs go up so much 2 weeks ago? I'm not sure why. Let's see. Why did they go up 2 weeks ago? Forgive me. I'm not 100% sure what the 2 weeks ago have anything to do with it. So if you could tell me a little more about it. Oh my gosh, lots of questions. I'm sorry, I can't even see them all. Let me see if I can expand this somehow. Okay. Sorry, Andrea, I'll get to your question in a second. Oh my gosh, sorry, I'm losing it here. Every time you guys ask me a question, it shoots the remainder of them up, so I'm having a hard time reading them in time. Okay. John Eric Allen from Baraboo. How about working with local schools to get students and parents enrolled using school buses to pick them up? There's a great idea. You should propose that to your school board. I like that a lot. I know a lot of local governments are trying to figure out ways to help enroll people. I think you should definitely propose that to them. Okay, Jeff Zidrali. The federal money to expand BadgerCare, what percentage above the poverty line will this apply to? Great question. Okay. If we accepted the federal funds for BadgerCare, that would mean that everybody who made up to 133% of the federal poverty line, which is about $15,000 for an individual, would be able to qualify for BadgerCare. Currently, they're setting that at 11, but even that's not kicking in until April. So basically, it's the difference between 11,400 for an individual and 15,000 and change. It's a fair amount of money. Granted, there's actually a second source of federal funding for BadgerCare. You've probably never heard of this, and I haven't even posted this post yet on our website. You'll be the very first person I tell, but there is a second source of federal funds for BadgerCare that would allow it to go to 2 times the federal poverty line. It's called a basic health plan. Minnesota is doing it. It's one of the few states that is, And that would actually be billions more on top of the billions for Medicaid. It's a different funding set, and that it will hopefully be something that we can continue to do to make sure that people can get quality, affordable coverage. All right, so Barb's question. For BadgerCare, I'm a little over the poverty line. Why don't they take medical consideration? I'm sorry, Barb, I don't really know how to answer your question. Let's see. Ian Gilson, copays for meds and visits for low-income people will make their insurance virtually unusable even with no premium. This is a disaster. Yes, it is, Dr. Gilson. We have a lot of people who are just over the poverty line but don't really have affordable coverage. And that's a terrible tragedy, and that's why we need to be accepting these federal funds. Because if you are making $12,000, you should not be paying a sixth of your income or more in copays and deductibles alone. So that's outrageous. Okay, Bill Waser from Reedsburg. How do you answer someone that says it is cheaper to pay the tax? Will hospitals change their procedures for people without health care? Hospitals will continue to accept people who come in emergency rooms, even if it's uncompensated care, if they can't pay. That's something that they're going to continue to do. If someone's going to say it's cheaper to pay the tax, you know what? That's technically true, and that tax will go up over time. But here's the thing. You could either pay the tax and get nothing, or you could pay a little bit more and actually get health insurance that'll be there when you need it. You can guarantee that you can get preventive services instead of paying off the nose. So this was always a choice. You can always choose whether or not you want coverage. But all this tax is a reminder that your decisions impact the rest of us. If you fail to get car insurance and get in a car accident, your decisions impact other people. If you fail to get health insurance, even by choice, and you go to an emergency room, you're pushing costs onto me. And so your decisions impact people. So you can continue to go without health insurance, but I would rather pay a little bit more and get health insurance that can never leave me, and it's there when you need to. I have John again from Baraboo. Did you get the school idea? I did. I believe I raised that one. All right, Andrea. Aetna wanted to raise our rates by $2,000, so we switched to WPS. Okay, I think I understand your question now. Health insurance costs have continued to go up for decades. 10 years ago in Wisconsin, it was half as expensive as it is now. That's a 200% increase in the last 10 years. All right. Health insurance was never about to suddenly be cheaper right away. I mean, it is in Minnesota. That's because they're doing everything right, and we're not. But Aetna is actually one of the companies that is not on the private marketplace. They chose not to be. They had the chance. And so they are not, you will not have the benefits of group purchasing that the marketplace provides through Aetna. So there will still be situations where insurance companies are going to try to raise their rates because they're trying to opt out of the health insurance system or health insurance marketplace. In which case, I would absolutely suggest that you shop around. You might be surprised of the new options in front of you on healthcare.gov. Okay, I have Kathleen Michael here. When I researched policies on healthcare.gov, the insurer listed their in-network provider and drugs list, as very inclusive. Now that I signed up for the policy and pay my premium, they drastically reduced their in-network providers. Sorry, it's kicking me around. Drastically reduced their in-network providers, as well as not covering our medication. Because they're so restrictive and nearly everything is out-of-network, the out-of-pocket costs are not applied toward my deductible. I can't change insurers. What options have I got to need? This brings up two really important points. One is that you should absolutely be paying attention to the networks that they list on the website on healthcare.gov. Not enough people are. A lot of them are narrow network or small network, and that just means you can go to certain hospitals only, and the reason they do that is because it's cheaper. So, for example, in southeastern Wisconsin, a lot of insurance plans are Aurora hospitals only. You can only go to Aurora. Now, that's not always the case. For example, Common Ground Healthcare Cooperative does let you go to any hospital you want, but you got to check that. Because if you wanted to go to, say, Columbia St. Mary's and you got a narrow network plan that didn't include it, that would be considered out of network, and you would be paying more. And so now that you've signed up now that you've already paid your policy, you may be able to see if you can switch plans and go back to the marketplace, but unfortunately that is sort of an issue that you're not exactly locked in. But Kathleen, I would suggest reaching out to me after this, and let's see if we can figure out how to get you covered with something better. So that's a concern that I want to see if I can help you fix. Barb, I am slightly over the income limit for BadgerCare. I have cancer costs, a lot out of pocket. Why don't they take medical costs I have to pay into consideration when figuring? Oh, I understand the question now. My apologies. So Barb has medical costs that obviously contribute to her needing health insurance and health care, but because she's slightly over the poverty line, you won't have BadgerCare. And this is exactly right. This is the reason why we're really trying to fight this issue of really denying people access to quality, affordable coverage. And this is why we have to continue to push into this. I'm sorry, Barb, that this is where we've left you, and this is why we have to continue fighting to accept the federal funds for BadgerCare. Let's see if we can talk afterwards and figure out how we can get your story into the public. All right. Kathleen, they listed it incorrectly. I was very careful. They changed it after I signed up. Oh, that is terrible. Okay, we should definitely be talking after this because that is really, really terrible. Okay. So, are there any other questions on here? I think I've plowed through them all. It looks like Ginny is asking Kath Michael. Ginny also has Anthem, and she is enrolled through the Affordable Care Act. She was told that Anthem that you can enroll and change plans within the open enrollment period. Oh, that's true. Thank you, Ginny, for reminding me. You should be able to switch during this open enrollment period, so try to switch now while you can. Oh, okay, here we go. Keith's got a good question. What do you think about the enrollment numbers for younger people so far in Wisconsin? Keith, that's a fantastic question. I actually made a whole video about this today that I don't know if we've had the chance to post, but I'm hoping that we get to post this soon. Some of you may have heard that brand new enrollment numbers came out yesterday for the country. About 3.3 million Americans now have health care coverage from the Affordable Care Act, private health coverage. By the way, on a side note, if you include all ways the Affordable Care Act enrolls people, Medicaid, young adults and their parents coverage, private coverage, etc., it's well in excess of 10 million Americans now have health coverage through the Affordable Care Act. But 3.3 million as of yesterday, 3.3 million at the end of January now have private health insurance on the private marketplace. And here's what this means for Wisconsin. It's not great news. It's great news that 56,000 people now have coverage, but the bad news is that we're actually adding people at a slower rate than the nation and our neighbors. Minnesota and Illinois are enrolling people at a much faster rate than we are. And that's partially because Wisconsin has spent the least in any state in the country per capita on educating people on the benefits of the law, letting them know how to access it. And so not only are we enrolling people slower, we have higher amounts of people who are over 55, which is a good thing in that we want to make sure people who are over 55 have coverage. But here's the thing. The way the marketplace really works is it really encourages people to get coverage, and especially younger individuals. We do not have to worry about somehow the law not working because we're not getting enough young people. That's not a problem. But what does matter is that if we do not have enough people signing up, if we don't sign up everyone we can, if our people who sign up tend to be older than others, Wisconsinites are going to pay more than they needed to. Wisconsinites are already paying more than people or Minnesotans and others from around the country. This is going to exacerbate the problem even worse. And so we need to make sure as many people get covered as possible and make sure that people are paying attention because state policy matters. The next big fight in healthcare is how to reduce costs and ensure more people have access, both through BadgerCare and private coverage. And the state is where this happens. So state policy matters, state elections matter, and we need to make sure that people understand this. And so we need to make sure that younger people sign up, but more people in general sign up, and should be encouraging the state to actually do more in promoting. Okay, thanks, Keith. I'll make sure that I'll post it, let you know when the video is posted. I think it was still being edited at the end of the day, so I apologize there. So Keith asks, can we truly say that the number of uninsured have been reduced by 1/4? No, 1/4 of, let's see, no, not really. Are you asking the number of uninsured within Wisconsin, I guess is your question there, Keith? Because technically before the law passed, there were about 500,000 uninsured individuals. Some of those will be in BadgerCare, but that's about a tenth currently of who've signed up. And unfortunately, those 56,000, we don't quite yet know if those are individuals who've all had no plans and suddenly got it, or may have had inferior plans and chose for something new. So we don't quite yet have our total reduction in the uninsured. We hopefully will soon. What about late-night ACA lookalike ads for cut rate coverage? Oh, this is fantastic. I've actually started getting mailers sent to my house telling me that they can offer me plans off the marketplace at different rates. It's fun. I almost want to put this online and let people know about these because they're sending them to the wrong person. Yes, there are companies out there that will continue to sell plans that are trying to get around the requirements of the Affordable Care Act. A lot of the big ones, like protecting people with pre-existing conditions, are true both on the marketplace and off the marketplace. But there are provisions that aren't required. So some insurance companies if they don't want to sell on healthcare.gov, they don't have to, but they lose out on some of the benefits, and they actually, they're allowed to do some things that ones on are not allowed to. And so some of the major companies like United, Humana, have both opted to not be on the marketplace, although they said they will next year. And then other companies, smaller companies, are still trying to let people know that they'll sell products off the marketplace and that they'll somehow get them a better deal. I'm very, very suspicious about those, but I think over time people will recognize that this is cut rate stuff and a better deal on healthcare.gov. Okay, cool. Looks like I've been getting a lot on the number of uninsured nationally was 40 million before the Affordable Care Act. That's true. Okay, I see what your question is, Keith. About 40 million before the Affordable Care Act. It actually might have been closer to 50 million. I think the law said it was going to reduce it by about 32 million. Again, the problem is the 10 million number that I used of people who now have health insurance or Affordable Care Act health insurance, those aren't all new people. Those aren't all 100% uninsured individuals who now have coverage who didn't before. Some of them had different coverage. And so that's the only thing. We will soon, at the end of open enrollment, be able to tell how many of them were uninsured beforehand, and so we'll have better estimates. But currently, I can't quite say that. No, I think I have another one. Okay, Kevin, fantastic. I hope everyone who's participating tonight let friends and neighbors know that they can see and hear the whole thing on their own time by going to Citizen Action's website or Grassroots North Shore site. Okay, thank you guys all for being here. This will all be saved and publicly posted on both of our websites. I want to thank you guys all for this. I believe we're done, and I will be around by phone or email after this, and you are about to be sent to a survey. Please let me know what you think, how else you can help, other ideas you have. I'm all ears. Please call or email me anytime. Check us out on Facebook. We do a weekly podcast, and we're always keeping busy. So never hesitate to reach out to us, because that's my job. I want to make sure that people understand this stuff. So thank you guys all very much, and have yourself a good Thursday evening. All right, let's get this. Why isn't this working?